Upper cross syndrome is a pattern of muscle imbalances that we see commonly in the office that can lead to neck pain, shoulder pain, back pain, that sort of thing. If you didn't see our original video on it, please check that out for some good background info. But just to sum things up for you, this pattern, we see a combination of muscle tightness and muscle weakness. We see tightness in the upper trap, that neck area into the upper portion of the upper back, and then subsequent crossed tightness into the front of the shoulders, anterior pec area. Then we see some muscle weakness or inhibition of the lower traps and the deep neck flexors. So when exaggerated, we find ourselves in this position right here. So it's important that we work on restoring those muscle imbalances. In this video, we're going to go over a couple stretches to address those tight areas, those areas that aren't moving well enough. So once again, that's going to be the area in the upper back, upper trapezius area, and in the front of the chest. In upper cross syndrome, we have some areas of stiffness or tightness that need to be mobilized. Some of these areas include the front of the shoulders and chest, and then the upper back. This one hits a little bit of both. So Zach's just gonna put his hands against the wall like that. He's gonna drop his hips back and just feel a good stretch through the front of the chest, a little bit of pressure into the upper back as that area extends. And you're just gonna rep through some motions of this, and then if you want, you can hold for a period of time as well. And this stretch feeds really well into the last one that we did. This is called open book. So you're gonna be on your side with your hips at 90 degrees, knees at 90 degrees, keeping those knees glued together. You're gonna reach forward with this top hand and then open up all the way as far as you can. If you've got a partner, they can put their hand on your knee, and then as you open up, put a little bit of pressure on your shoulder here. That's just gonna encourage some stretch through the front of the chest and some mobility into the upper back. So if you're experiencing neck pain, shoulder pain, back pain, it could be the result of some of these imbalances that we mentioned here. So if you're experiencing pain, it is important that you be seen by a medical professional before trying to address any of these issues on your own. And we would be happy to help. Visit us online at TruMotionTherapy.com to learn more or book an appointment.